Hello and welcome to this special episode brought to you by Hospitals and the Arab Hospital Magazine YouTube channel. Today we're shedding light on a topic that is often overlooked but deeply impactful, men's fertility. Joining us is a leading expert in the field, Dr. Ali Dabaja, a board-certified urologist at Henry Ford Medical Center, specializing in male infertility, sexual health, and reproductive medicine. Dr. Dabaja will surely bring both clinical expertise and compassionate insight to the conversation. So let's get started. Hello, doctor.
Hi, Mirna. Thank you for inviting me and to be part of your channel and be on your show. Appreciate it. Thank you.
So it's our pleasure to have you. So, doctor, can we start by explaining what male fertility means and what factors influence it?
No, that's, this is a very important topic, and it's a topic that often overlooked, and there's a lot of, taboo and misconceptions. And I'm glad that we're having this conversation to shed light on this very important, health aspect of our patients. And so male infertility is, it's more common than we think it is. And, it's defined as basically when you have a couple trying to conceive, and they've been trying to conceive for almost a year, and they're having difficulty with conception. And after they attempt to conceive for a year, on an evaluation, if there are factors found that points the direction of the problem toward the male partner, that's what we call male infertility.
Okay. So, doctor, we witnessed a rise in male infertility in the past decade. So what are the main reasons? First, is it true? And what are the main reasons for this?
Yeah, it's actually, there's a lot of articles in the news and a lot of, social media channels that are talking about this. There is truly some changes in fertility potential in male globally. Mm-hmm. Studies have suggested that there's a decline in the average sperm count and an increase in the male infertility. And this could be due to multiple factors. One, it could be because we are more aware and we're testing more. Now that we're having the conversation, people who are listening to this conversation are going to get tested. So there's more awareness. And there is actually an increase in exposure to chemicals out there, specifically disrupting chemicals. There's a rise in obesity and its chronic diseases and chronic stress. People are a little bit more, nowadays the environment out there is more stressful and sleep hygiene is not well. So there is a potential that there is some decrease globally in the fertility potential of male, and we're seeing that.
So you are saying that lifestyle factors can impact fertility in men. So like stress, smoking, obesity, alcohol, maybe. So is there any link between these two, and the environmental also toxins like, like laptops, mobiles, computers, all these?
Yeah. No, you're right on, Mirna. These are all factors that we counsel patients to avoid. Smoking is a big one. Obesity and poor diet is another one. Heat exposure, some think it's a myth, but if you're sitting in the hot tub or the sauna every day for a few hours, probably there's something to it.
Okay.
Sedentary lifestyle is also a factor, and people that exercise probably gonna be healthier. And the way I explain this to my patients, I tell them, healthier body, healthier sperm.
Okay. So how does a man know if he has fertility issues? Are there any visible signs we can see, or he should do tests only by testing?
Great question. If you've been trying to conceive and it's been a year, you and your partner are having difficulty, that's the time to get tested. Mm-hmm. We do recommend that you get tested a little bit earlier if your partner's age is a little bit above the age of 35. Mm-hmm. Then we recommend that you get tested at 6-month period of attempting to conceive. The test that we typically do for infertility is a semen analysis. And we typically do 2 semen analyses. And the goal is to identify if there are abnormalities in the sperm count, motility, and morphology, and to figure out if any of these factors are altered. Because if they are and they're decreased, then there is a higher likelihood of infertility in that patient.
So usually when you have a couple and there's a problem with getting pregnant for the woman, I mean, so the first thing they think it's the woman's fault, it's not the man's. So how do you deal with the man's, reaction to this?
I see this all the time. I see this in clinic. I see this in society. People, there's a lot of myth and taboos about this. The reality and the numbers speaks for themselves. 50% of factors that lead to infertility is a male factor. The other 50% factor that lead to infertility is a female factor. It's a 50-50. So whenever
it's 50-50.
Yes, and whenever there's difficulty conceiving, I recommend both to come to get tested.
To get tested, yes. And what are the available treatments for men if they are diagnosed with infertility?
So I start simple. When they see me in clinic, I'm like, okay, let's start with the basics. What are you doing that could be affecting your fertility potential? Are you smoking? How much alcohol are you consuming? Are you exercising? Are you having a good diet? Then we do the test, right? And then we do some basic vitamins and antioxidants just to help as a potential with the fertility potential. So these are all things that we can do for our patients as a beginning step.
Yeah. And do you think this can improve the fertility without any medication? In some cases, I mean.
Well, we start with the simple things first. Then, after the testing, we usually do further investigation studies. It could be hormones, it could be imaging, it could be multiple other factor testings that we can do. And based off of the results of these tests, then we can determine if there is a need for medical treatment, or in some cases, the patient might need further intervention. Like advanced reproductive treatment or surgery to correct the problem they might have.
Mm-hmm. So, how effective are these treatments, like hormonal therapy or surgical sperm retrieval? We know that you do this sometimes.
So, great question. Really, it all depends. So, if there's a hormonal imbalances and we correct the hormones in patients that have these specific diagnoses, it could help. Some patients might not even respond to hormones. So, then those patients, the hormone treatment might not help. And then you have surgical treatments, and it really depends what surgery you're doing. There's a broad array of surgical treatments for infertility. Sperm extraction is one of them, and typically that is reserved for a couple where the male partner does not produce sperm. And the success rates of those is dependent on the condition that is causing the azoospermia or the lack of sperm. And so it's what I tell patients and couple is that each treatment need to be tailored to the couple. It's infertility is in a way you have to view it as a couple's disease. It's not like one person versus the other. You have to take the whole family planning as a package.
Mm-hmm. So we see also a decrease in testosterone in men at an early age. Does this affect fertility at a later age?
Well, hormonal imbalances they're not as uncommon.
Mm-hmm.
And if someone wishes to have children in the future and they have infertility, the treatment is typically not to give testosterone, but the treatment is to actually prime the body to produce its own testosterone. And there are specific treatments that we give, like Clomid or ECG or other medication that prime the body to produce more testosterone than what it is originally producing.
Mm-hmm. Mm-hmm. So we hear a lot about the woman's biological clock. We know that at a certain age, women can't conceive anymore. So what about men? Does age affect men also fertility?
Yeah, I get this question all the time.
Yeah.
You know, in women, there's an age of 35. It's like that after that age, there's a drop in the fertility potential.
Yeah.
Men, there's a slight drop and slight decline in the fertility potential because of sperm quality changes.
Okay.
Also, the older men, and I counsel my patients on this, they have higher risk for having children that might have autism or schizophrenia, and that is typically after the age of 55. And so, age does affect, the fertility potential. It's not as dramatic as we see in the female partners.
Okay. So it does impact the health of the baby. I mean, also.
To a certain extent, also the quality of the sperm.
Okay. So, what are some common myths about men fertility that you often hear about from your patients when they come to you?
Yeah, we touched upon one of them earlier. Like one of the most common thing that most of my patients, or some of my patients, think that infertility is a woman disease only.
Yeah.
As I said earlier, it's a couple's disease. If I'm strong and I'm muscular, it must not be me. Well,
No.
that's really not true. And there's a lot of barriers when it comes to treatment of infertility because of social and religious reasons. Certain treatments are not possible, and so those barriers can be something that we have to sometimes counsel and overcome with patients to at the end of the day, to have a beautiful baby for the couple to raise.
Yeah, sure. So there's a myth also, I think most men, they ask you about, is that frequent ejaculation reduces the number of sperms or sperm count. So also.
Yeah. It's interesting you say that because some couple come up with information from online, and some of these are misinformation, and they follow them, and actually it can be harmful to a certain extent. But typically what we tell the patients that actually at the time of ovulation, when you're timing relations, you should actually try to have relations every other day before starting the look for ovulation. So you want to increase the frequency. It might temporarily drop the sperm count for that period of time, but then it picks up again. And then there's actually some evidence out there that says that patients who have multiple ejaculations, they might have improvement in their sperm quality, the DNA. And so we sometimes see that, and I tell my patients, just have a normal relationship. Like don't try to frame everything into a box. Then that's when the stresses add to the relationship.
Yeah, true.
Then, it becomes unenjoyable. Like the journey have to be, it's going to be a stressful journey, but don't put strain on the relationship.
Yeah. Okay. Yeah. So, what are the steps can men take early to preserve or boost their fertility? Is there anything they can do?
Well, one is live a healthier lifestyle. Try to avoid things that we know that can suppress sperm production. Smoking is one of them. There's a lot of men out there that in their young age want to be muscular. They might use some anabolic steroids. Try to avoid those things. Those treatments do decrease sperm production and can affect their fertility potential in the future. So try to avoid these things as at any cost if you can. And if you have early signs and symptoms of low testosterone or anything along those lines, consult with a physician. Get tested. It's some things can be reversed, and you should try to get evaluated as early as possible.
So, in your opinion, it's not anymore a taboo for a man to go and check himself. I think in certain countries around the world, there's still like, this taboo because men, they don't have a problem. They always say it's the woman's problem. So I think in the United States, it's better than other parts of the world. I don't know, like the Middle East, maybe.
Yeah, no, it's there's a lot of misnomers. You know, certain countries have tests that you can buy from the pharmacy, test yourself at home. And so here in the United States, these tests are available. They're called point of care testing. You can do it, whatever you want to do it, and comfortable to do it. So it's not wrong if there's any doubt to consult with your physician. It does not change who you are. And if anything, it actually might build you up and get you more confidence because you know the answer and you know there's a treatment for it. And there's still a lot of social and barriers out there. And the goal is to keep educating and get people comfortable with testing and getting evaluated and getting treatment.
Sure. So what is your advice for couples going through this emotional, stressful thing because of infertility, I mean?
Yeah. I was alluding to this earlier. Couple who are undergoing fertility treatment have a lot of strains on their relationship and a lot of stresses. There's a lot of anxiety, a lot of unknown, and that drives couple to have some friction. But I tell my patients this: it's a journey, and at the end, you want this journey to be not a strain on the relationship, and you want to be able to openly communicate with your partner so that you don't have resentment at the end of the road. So, and God's willing, if you undergo through treatment and everything pans out, you're going to have a beautiful baby that comes home with you. So, the end game is going to be the same, hopefully.
And what is the percentage of these treatments, success of these treatments, I mean, when it comes to men's infertility?
It really all depends on what the cause is and what treatment you're using. But and what modality you're providing for your patients. And it's a very broad question, but what I'll simplify it to that, partner up with your physician, make sure you're getting the treatment plan that best fits your condition, and eventually you'll lead to success.
Can you tell us briefly what are the main reasons of infertility that cannot be treated at all, if there's any, I mean?
I don't want to cause angst and have people lose hope.
Yeah.
We try to do our best to provide as much as possible to our patients the best treatment option. But there are conditions that they're hard to treat, and alternative options might be need to discuss. And sometimes we need to have the hard conversation with couple about adoption and sperm donors, and those are on the table.
Mm-hmm. So do you see any, for example, I mean, work of AI in these in genetics, I mean, AI or genetics in this male fertility problems?
Yeah, so we do screen a lot of patients with infertility for genetic causes. So we're doing a lot of that already. And you can even screen to make sure you and your partner are not carrier of certain diseases, especially if you're undergoing IVF. There's a lot of new softwares out there and a lot of new technology out there that actually is automating some of the tests that we're doing for infertility, specifically semen analysis. And so these are happening right now as we speak, where labs are using AI to do, sperm morphology testing and DNA fragmentation index testing, and all these things that space is, growing exponentially. As you know, AI is taking over the world. And then also there are AI technology that is being tested to evaluate embryos in IVF labs, and more to come. I think the future is bright, and there's a lot of opportunities out there.
So, doctor, we know that women out there, even the young women, they are getting tested at an early stage now for their fertility, egg count. They are freezing their eggs at an early stage. So, is there anything men can do also to, for their future?
Yeah. Amazing question. I have few friends of mine that are undergoing egg preservation as part of their family planning because they have chosen to delay starting a family for professional reasons or any other reasons that might be. And I high fived them when I heard that they're doing that. I think kudos to them. Similarly, can be done in men. Now, in men, as I was talking about earlier, the sperm count doesn't drop dramatically. The quality might change a little bit, but people do it. There are some that are doing it out there. But it brings up a really important point, which is sperm banking in certain patients that might undergo treatment that can affect sperm production. So let's say a cancer patient who is about to undergo chemotherapy, or patients who might undergo immunomodulating therapy or surgery that can prevent them from producing sperm again, and sometimes radiation that can be. Then we ask these patients to sperm bank ahead of time, freeze that sperm, and that sperm can be frozen forever. They can use it anytime they want after they complete the treatment. So there's a lot of programs out there now that we do that here as well in the United States and at Henry Ford.
Great. So last question, doctor, what message would you like to give to men watching this now and concerned about their fertility?
Yeah. Honestly, if you have any doubts, if you have any symptoms, get tested, consult with a physician. Ultimately, there are a lot of solutions out there that can help you, and treatments that can improve your fertility potential. And don't suffer in silence. Just seek out help.
Thank you. It was a great discussion, doctor. It was a pleasure for us, and hopefully we'll have another one soon.
Mirna, this is lovely. Thank you for hosting me, and I appreciate it. I hope to see you soon.